OCD is a heterogeneous, very often chronic and severe psychiatric disease that affects millions of people worldwide of every gender, age, nationality, race, religion, and socioeconomic status. This disorder is characterized by recurrent, intrusive, and distressing thoughts, images or impulses, which are called obsessions, and repetitive mental or overacts, which are called compulsions, performed to reduce or remove distress and anxiety caused by these obsessive thoughts and to prevent any perceived harmful consequences. It can cause significant distress not only to people who suffer from it, but also often to their families and partners, and may lead to high levels of impairment in quality of life and even to disability. This disorder has a lifetime prevalence of approximately 2–3% of the population worldwide, or approximately 1 to 40 adults have OCD, and then 60 million people worldwide. It has been estimated that about 4 to 5 million people in the United States and approximately 750,000 people in the UK are living with OCD at any one time. OCD is associated with high health care, economic and social costs. The financial cost of this disorder solely to the US economy is estimated to be about 8 billion per year. A study by the epidemiologic catchment area found that approximately 36% of patients with OCD have occupational difficulties, and on average, people who suffer from this disease lose up to 3 years of wages during their lives because of the illness. About 25% of patients with OCD experience problems with marital relationships, and people affected by this disorder are less likely to marry than people without obsessive problems. Although many individuals are affected by OCD, many are also still hiding their symptoms. Some with OCD are reluctant to talk about their symptoms due to the fear, embarrassment, and shame of being labeled, while others are unaware that their experiences constitute an established psychiatric condition. Therefore, OCD is most likely underdiagnosed and undertreated. Epidemiological research estimates that more than half of the patients with OCD, about 54% in the United States, receive no treatment at all. Worldwide, the figure goes up to about 60%. The average amount of time that passes from patients' first experience of symptoms to when they receive a correct diagnosis and seek professional help ranging from 7 to 9 years. This delay may be one of the reasons for the chronic course of the disorder. Mindfulness-based cognitive therapy for OCD is an innovative, validated, and manualized treatment program designed to create a significant clinical and life improvement in people who suffer from obsessive-compulsive disorder. The program integrates the most effective tools and strategies of cognitive behavioral therapy, which is the most effective treatment for OCD, with the clinical application of mindfulness and compassion practices and principles. This therapeutic program is the culmination of about 20 years of work with hundreds of people affected by OCD and 2 decades of practicing and teaching mindfulness meditation, especially MBCT. The heart of MBCT for OCD lies in acquainting patients with the modes of mind and cognitive mechanisms that characterize OCD, while simultaneously inviting them to develop a new relationship to their internal experience. Patients learn to view thoughts and emotions as harmless and impermanent events in the mind, independent of their content and emotional charge, developing some core therapeutic skills such as decentering, disidentification, and acceptance toward the internal experience. Over time, and through intensive practice, both during the sessions and at home, this step-by-step intensive therapeutic program aims to help individuals with OCD to recognize and overcome the mental biases and dysfunctional mechanisms that activate and maintain their disorder, to learn new effective strategies to neutralize those mechanisms, and to develop stable and healthy ways to relate to their internal experience. The main work of the program is done at home between classes, using audio files with guided exercises that support participants developing skills outside of class. Home practice will take about 1 hour a day, 7 days a week. MBCT for OCD is made up of 11 sessions, each lasting 3 hours, except for the last session, which is a full-day session of intensive practice and review, and can be effectively provided both in group and individual setting, and both in person and online. We have now some important evidence through some studies, in particular an open trial and a randomized controlled trial, about the outcome of this program, which show us that MBCT for OCD is at least as effective as medication, but without the side effects of it, and that this significant improvement is maintained at follow-up. There are currently 3 possible levels of certificates and training available through the MBCT for OCD Center for licensed mental health professionals who want to receive training in MBCT for OCD and apply the program both in an individual and group setting. The 3-day MBCT for OCD introductory workshop, which is a first level of training, and the second is the 5-day MBCT for OCD professional training, which qualify the participant to use MBCT for OCD both in individual and in group format. And the final step is the 5-day MBCT for OCD advanced professional training, aimed to improve and deepen participants' knowledge and understanding of the MBCT for OCD model and the skills needed to implement the program effectively.